Hello and welcome to today's info lecture. Today's information is provided by Dr. Brett Lemire from the Universal Chiropractic Spine and Sport, and in this discussion we will be discussing the principles and methods of self-myofascial release and the role it plays in improving and maintaining health and fitness of the musculoskeletal system. Just a little bit about Dr. Lemire's background. He has been a chiropractor for over 20 years and owns a clinic that is located here in Elk Grove, California. The clinic specializes in treating a wide variety of musculoskeletal conditions, as well as treating a wide range of age groups and working cooperatively with multidisciplinary practitioners in the area. Oftentimes, the secret to maximizing results stems from developing a consistent and daily routine, and with SMR techniques, it's no different. As we will discuss shortly, SMR is highly beneficial when used to address adverse physical effects due to occupational or athletic exposures. Having an organized system that has specific tasks like self-myofascial release can have a profound effect on the success of a self-care program with regard to an exposure. Let's take a look at how you can organize your self-care plan by what is referred to as the 10 R's of care. The first R is realignment of body posture. This helps to minimize the stress placed on musculoskeletal structures as you perform your activities of daily living, demands of employment, sports, and recreational activities. Simply put, as a body out of alignment is more susceptible to injury. The second R refers to the release of tight tissues, and this is the area of self-myofascial release, stretching, and mobility work. This is analogous to taking the emergency brake off before you put your foot on the gas pedal. The third R is reset the core. This refers to resetting or turning on the core to ensure the connection between the pelvic structures, which houses the center of gravity, and the rib cage structure, which houses the center of mass. This helps to ensure that there's good force transmission to the core, stabilizing muscles of the spine. The fourth R is reactivation. This refers to exercises that help prepare the body for the demands of movement in a fitness, work, or recreational environment. An example of this would be a plyometric loading movement pattern in preparation for golf, baseball, CrossFit, etc. The fifth R is resiliency. This refers to resiliency or your aerobic capacity, which is reflective of endurance-based exercises. The sixth R is resistance. This refers to any form or mode of resistance training. The seventh R is refuel. This refers to hydration, nutrients and supplements, all that help aid sustainability and recovery. The eighth R is repair. This is the use of SMR and massage therapy, cryotherapy, and other limbering type protocols. The ninth R is recovery. This refers to getting adequate sleep, rest, relaxation, meditation, prayer, etc. And the 10th and final R is repeat exposure. Hopefully you're ready to start the cycle over again. Today there are numerous studies validating the effectiveness of self-myofascial release techniques in the treatment of musculoskeletal conditions and its use in movement preparation for sports and recreational activities. Next, I'd like to cover some terminology that's out there in the literature, which can be confusing. Stretching is a mode to improve mobility. Mobility and flexibility are very close in terminology, but they're slightly different. By definition, flexibility relates to passive range of motion, such as when a therapist or doctor measures your shoulder range of motion, while mobility is more associated with active range of motion, such as when we assess how deep you can squat correctly. It's also important to note that some exercises might improve flexibility in a body region, but may not improve mobility. In summary, flexibility is your ability to be moved or bent. Mobility is your ability to move or bend. And stability is your ability to control or resist movement. Factors influencing ability in the body can be broken down into two structures. First, muscle structures must have the proper extensibility or flexibility to be able to function in a usable range of motion. While ligament and joint structures' most functional integrity is to limit range of motion and act as joint stabilizers along with intrinsic muscles surrounding the joint. In the presence of ligamentous laxity, there is a risk due to lack of joint stabilization. Compromise in muscle extensibility, ligamentous and intrinsic muscle stability, along with joint laxity, are all predisposing factors to injury and joint wear and tear. And other factors affecting movement, impairment, and mobility include scar tissue formation, adhesions, etc. This is where self-myofascial release techniques can be extremely effective. From the nervous system, we often see a lack of motor outputs from the brain, which is capable of generating usable range of motion at the joint despite the muscle having adequate extensibility. This is often referred to as movement amnesia. An example of this is when a person simply can't do a deep squat because of motor control issues. Other factors affecting movement impairment and mobility include scar tissue formation, adhesions, etc. This is where self-myofascial release techniques can be extremely effective. The body is composed of a linkage-like system that essentially is a stack of special designed joints, with each joint or series of joints having a specific function, and when exposed to injury or adverse stress, they become prone to predictable levels of dysfunction. Joints, muscles, and other fascia have been referred to as a chain due to the anatomical and functional nature of their overlapping and intertwining structures. As you can see in the picture, starting from the bottom up, the foot is stable and the ankle is mobile, the knee is stable and the hip is mobile. The lumbar spine is stable and the thoracic spine is mobile. The scapular thoracic joint is stable and the glenohumeral joint is mobile, and this functional process repeats itself throughout the entire body. Why self-myofascial release for fascia? Well, 1. Fascia surrounds all organs of the body, including the skin, joints, and muscles. It also forms a 3D internal network for the entire body, literally connecting us from head to toe, side to side, front and back. It is highly innervated and provides information to the brain about the body's position, tension, load, and movement. Fascia is also highly pain sensitive and susceptible to scar tissue formation from injury, disease, or misuse. The 3 most common tools for self-myofascial release include the foam roller, lacrosse ball, and the roller stick. And it must be noted that some of the tools can also be used separately or in combination with each other. I would also point out that there are other tools in the market that have also been shown to be effective for SMR. Which tool is best for SMR? Let's start with the foam roller. The foam roller is good for the whole body work, for the spine and torso, shoulders, hips, and legs due to its broader nature of design. It utilizes passive and active body weight for pressure into muscle and fascial structures. It's good for rolling over trigger points and tender points. Foam rollers come in different densities and firmness, and they could be knobbed surfaces and can generate deeper pressure points on the soft tissue structures. It's good for the gym, home, or at work. The roller stick is also good for the neck, upper and lower extremities, but only at a limited capacity. It requires the use of both hands to push the stick into the soft tissue structures. It's good for rolling across fascia that surround muscles and tendons of the lower leg. The lacrosse ball is also good for the spine, torso, shoulders, arms, hips, thighs, lower legs, and the bottom of the foot. One of its unique benefits is the ability to generate pinpoint pressures on the soft tissue structure. You can use 1 or more balls on a particular body region, and it's easily portable. Foam rolling is a common form of myofascial release, often used by fitness enthusiasts, athletes, workers, and any of those people with signs and symptoms of persistent musculoskeletal function. Athlete exposure is really the unit of susceptibility to injury, which is defined as one athlete participating in one game or practice in which he or she is exposed to the possibility of athletic injury. An example of athlete exposure is participating in one game, training, or practice in a 24-hour period, which would count as one exposure. An athlete training in the morning with the game in the afternoon would be 2 exposures for that day. Occupational exposure would be an individual whose job demands have stressed the body in a physical, psychological, chemical, or emotional capacity. Sedentary exposure is repeated exposure to a hypokinetic environment, like excess sitting. As you can see, exposures can start to add up quickly within a 24-hour period and throughout a work week. Ideally, utilizing SMR before and after an exposure would yield optimal results by improving movement preparation and recovery cycle. In summary, recent research indicates that SMR is an effective method for improving flexibility, mobility, subjective markers of recovery, and improved athletic performance. Furthermore, as no optimal sets, reps, durations have yet to be identified, it may suggest that following recommendations provide the current best guidelines based on the available research. 3 to 5 sets of 20 to 30 second repetitions, 3 to 5 times per week, performed on a consistent basis to achieve and retain the chronic effects of flexibility and mobility. In my opinion, that's adding active range of motion and positions requiring stabilization of the trunk, which can enhance the effects of SMR. Self-myofascial release is a safe, effective, and worthwhile tool which aids in movement readiness, movement performance, and recovery from physical stressors of life, like demands of employment, sports and recreational activities, and other activities of daily life. It's important to learn correct technique and dosage to get the job done well. Consistency is also key. Schedule time for yourself and don't be rushed with self-myofascial release. For any further questions, contact Dr. Brett Lemire at Universal Chiropractic Spine and Sport at 916-683-3900 or via email at bjlback@aol.com.